Welcome to Speak Life with Dr. Amy Chai. Information for your best life. Now, here's Amy Chai.
Hello again, everyone, and welcome once again to Speak Life New Haven. Today, we're going to start with the second part of my mental health series, and it's going to be talking about probably the most common mental health disorder that there is out there, and that's depression. So, depression is sometimes hard to tell the difference between, am I just feeling sad? Or is this something more? Is this clinical depression? Do I need treatment? What can I do? Or you may have a friend or a family member and you're concerned. You wonder, should I do a safety check? Are they okay? Should I get help for that person? These are the kind of topics that we're going to talk about today. And we're going to talk about clinical depression, what it is, how to recognize it, and how to treat it. So let's go ahead and get started. The first thing I want to talk about is the numbers. What numbers are we dealing with? What are we looking at when we're talking about depression? Well, first of all, before I say anything else, I want to get your attention to the first number here, and that is 988. So 988 is the emergency number. It's sort of like 911, except it's 988. So that's our new number, emergency number, for if you're having a mental health emergency and you really need someone to talk to, go ahead and dial 988. But there's a lot of other numbers associated with depression, and I think some of them are going to surprise you a little bit. The first number is 1,200,000, and that is the number of suicide attempts that happen every year in the United States. And this data, of course, it's 2020 data, but it's close enough. This is a big number. Over 1 million people try to end their lives every single year. But even sadder than that number is the number of people who achieve their goal. The number of people who actually commit suicide is 45,979 people die every year by taking their own life. And that's really a very tragic statistic. It's something that really should be preventable. What does that mean? It means that every 10 minutes, someone dies by their own hand in the United States. 3 people will die by the time this show is over from suicide. It's the 12th leading cause of death in the United States. And it's kind of interesting because you see there's a big difference between the number of suicides that are actually completed suicides versus the number of people who attempt suicides. And it seems as though almost 70% of people who actually successfully kill themselves are white males. And why is that? If you want to think about it, you might want to think about, well, what kind of suicide is going to be the most lethal or the most, I guess you might say, effective? And that's access to handguns. So when you think about the demographic that has probably more handguns than most other people, it's going to be white males. So access to lethal means is a very important predictor of who will actually die by suicide. And interestingly enough, there's what's called a bimodal distribution of age groups of people that attempt suicide every year. There is a peak in the younger ages, like the late teens and early 20s. And then the suicidality drops down for middle adulthood. And then as people get older, starting at around 60 years old, the rate of suicide attempts goes up dramatically. And believe it or not, 85 and older has the highest rate of completed suicide compared with any other group. And when I saw that, I mean, it really shocked me actually. And the reason is that you don't really necessarily think of elderly seniors as committing suicide, but there's a lot of very desperately lonely, desperately depressed seniors out there, and they are taking their own lives. Now, these numbers, when I look at these numbers, I think, how do we get these numbers? And the numbers of suicide attempts that we have here, these come from emergency room records and hospital records and things like that. But there are other things that happen that we don't detect, like somebody may have taken pills and then they wake up and they don't report it. There's another very important thing, and that is deaths that appear to be overdose related deaths. A lot of those deaths are actually intentional, and we'll never know which ones are intentional and which ones aren't because nobody's telling any tales. And another potential cause of suicide that isn't being counted is actually going to be single car traffic fatalities. So that's a lot of numbers. That's a lot of people. The 12th leading cause of death. What can we do about it? Well, the final number that I have put up here is actually the number of people in any given year who experience an episode, at least one episode of clinical depression. That number is 16 million people. 16 million people every single year experience clinical depression. Wow, that's a lot of people. It's very sad. So let me bring up the next slide. How do we recognize clinical depression? What's the difference between clinical depression and just feeling down, feeling blue, feeling sad? Everyone gets sad, everyone gets down, everyone gets depressed sometimes. But clinical depression is more than just feeling down. I'll explain a little bit more about that. Clinical depression requires that a person has been feeling a certain way for a minimum of 2 weeks, most of the time, or almost all of the time. And the first two things that have to be present in clinical depression is either one or two of the following. The first one is the typical feeling sad or feeling down, crying all the time, feeling quote unquote depressed. And you would think that that would be one of the major categories of being able to diagnose depression, and it is. But the second thing that may be a diagnostic criteria is actually what is known as anhedonia. And what's anhedonia? Anhedonia is actually the inability to feel pleasure or the lack of interest or joy in the things that you might have enjoyed doing in the past. So a patient may come in and they may not be identifying as feeling sad or down or tearful, but they just simply don't have that feeling of pleasure. They don't want to go out with friends. They'd rather stay home and hang out, and read a book. They might just want to go hide out in their bedroom. They don't want to go outside and exercise. It's kind of hard to get them out of the house. They may not just enjoy doing the things they used to enjoy doing. So those are the two major diagnostic criteria. But other things need to be present to get the diagnosis. The additional features listed here include changes in appetite or weight. That would be maybe eating more or less than you would normally eat. That is a criteria. Slowed movements, just going through the day slowly, like you're in a fog or in a cloud. And not just feeling that way, but other people may notice. Like it seems like someone might say, "Oh, hurry up," or "Why aren't you keeping up with the rest of us?" So being slow is another associated symptom. Also, a significant fatigue or a feeling of loss of energy, just no motivation, just wanting to, basically just get through the day, go home, and not go out. Just feeling like you don't have the get up and go to do the things you might want to do. Another one is feeling worthless, feeling inappropriate guilt, feeling like you've let your family down, feeling like you've let yourself down. And those feelings can begin to eat at your mental health. Like, why did I do that? Why didn't I do that other thing? It's basically sort of ruminating on thoughts of worthlessness of yourself. Um, Another possible symptom would be trouble concentrating, being indecisive, having trouble thinking, concentrating. Maybe you can't get all the way through that book that you're cuddling up with at night. Maybe you just don't feel like reading the rest of that newspaper. And of course, the most serious symptom of all would be thoughts of death, thoughts that, you may just want to go to sleep and just not wake up. Um, Thoughts of, what it might be like not to be alive anymore. That's called suicidal ideation. And that can be either passive, which is thinking, oh, I don't really want to live, but not really thinking of any active plans to hurt yourself. And then there's the active kind of suicidal ideation where you're actually having plans or attempts at suicide. So, along with this whole diagnosis of clinical depression, some other symptoms that may come along with it might be feeling of pain all over your body, feeling of an upset stomach or indigestion, like little physical symptoms that seem to go along with it. So, all of those together, if you talk to your doctor about them, all of those could be related to the diagnosis of clinical depression. But clinical depression, or major depressive disorder as it's called, it isn't always what you think. It isn't always the classic symptoms that you've suddenly gone from better to worse, you've suddenly lost interest in things, you've suddenly changed your mood or your behavior, um, because there are depression variants. And the most common depression variant is actually called atypical depression. And I think that atypical depression is really a misnomer because atypical depression really isn't that atypical. The main atypical thing about atypical depression is that people who have atypical depression can have like a happier or a better mood when things in their life are positive. So they have temporary periods of time where they're feeling upbeat or good, and then they kind of sink back down into their usual state of feeling depressed. So what these people have is they have a feeling of long term just not feeling happy. And this can occur over years. And often, I mean, diagnostically, it's typically over 2 years, but many people have this for their entire lives. Um, Oftentimes, it will actually start in the teenage years and it will kind of sort of be sort of a low level, constant depression that's always there. And instead of feeling tearful and sad all the time, there's some slightly different symptoms. It tends to be predominantly a feeling of just not a lot of joy or not a lot of pleasure in activities that other people enjoy. And that's what it says. The anhedonia is a big part of the atypical depression. The other interesting fact is that it's 4 times as common in women as it is in men. So this is very much a disease that women have, and it's up to about a third of all depression is this depression variant called atypical depression. Now, one of the risk factors for atypical depression besides female sex is a history of trauma. It could be abandonment, it could be abuse, it could be significant losses, oftentimes childhood traumas. Those are very much in the background of people with atypical depression, and also a family history of depression, like especially bipolar disorder. So, um, another different part of atypical depression is that a lot of these, and I'll say women because it's usually women, will have binge eating, weight gain, and they'll constantly feel tired. They just have a very leaden feeling, and it's been called what they call leaden paralysis, where you just feel like you're kind of walking through life on leaden legs. Everything in your life seems heavy. Um, and a lot of times there's some anxiety associated with it. Um, and so it's not your classic, like, deep, dark depression, but it's kind of a chronic low level depression. And this particular depression variant is very high risk of suicide. In fact, it's a higher risk of suicide than some other types of depression. Um, and there's also anxious depression, which, as you can imagine, is more has more anxiety symptoms with the depression, and postpartum depression, which occurs, of course, after childbirth. And there's other depression types too, such as or bipolar depression that goes along with cyclothymic disorder, bipolar 1 and bipolar 2. So there are a lot of diseases that go along with the diagnosis of depression, and it's very, very common. In fact, almost 1 in 5 people will experience some episode of depression in their lifetime. And not surprisingly, perhaps not surprisingly at all, it does tend to correlate with a little bit with things like socioeconomic status. So people who are living in impoverished environment are more susceptible to depression. There's also genetic heritability that goes along with your risk for depression. Substance abuse, alcohol abuse, these things go along with the development of depression. And sometimes it actually causes depression, like drinking or using drugs can actually precipitate depression in a susceptible person. So that's kind of what depression is. That's kind of what depression looks like from my side of the desk. As a physician, when I'm looking at you, I'm looking to see if you have major depressive disorder. And if so, is it something serious enough that maybe you need medication or even you may need a hospital stay? So if you're having any of these type of symptoms, I would really strongly suggest that you bring them up, and the first person you want to bring them up with usually is going to be your primary care doctor. So, your primary care doctor does know how to treat depression and does know when to refer you if it's more serious than they feel comfortable dealing with. So, you don't have to make an appointment with a psychiatrist. You can just go right to your primary care doctor and just talk about the symptoms that you're having. And I would strongly recommend that if you see yourself in any of these symptoms that I've been talking about. But what if you have family members that you're concerned about, friends that you're concerned about, and you're wondering, is my friend depressed? Is my family member depressed? What should I look for? I don't want to be there. I mean, we've all heard it before, how did we not know that they were depressed? How did we not know that they were at risk for suicide? And now you should pay very close attention to this next portion of the show. So I'm going to pull that up and I'm going to say, this is the face of depression. Okay. A happy face, a smiling face, a face that is often a mask for the emotional state that lies beneath. And I think that's especially true again for women, because women have been really socialized to kind of suppress negative feelings and to smile a lot and to be, you know, agreeable and to not really be needy or talking about, their own symptoms. So I feel also that females are more likely to have the false mask of, smiling, happy faces, which are really just hiding the depression that lies beneath. So just because someone is happy and smiling or joking, for men, sometimes it's more the jokester or the party boy who's actually joking or drinking or, partying as kind of a mask to cover for their symptoms. And then the woman is more smiling and pretending like nothing's wrong. But we've all seen these people. We probably all have someone in our life right now, that is hiding depression, either under a mask, a happy mask, or they're hiding it with alcohol, drugs, partying, joking, and they need help. So, what are some other ways that we can understand what it might be like for someone who's depressed so that you, as a friend, as a parent, as a family member, how can you understand depression better if you've never experienced it yourself? One of the things that I've heard a lot from people is that depression is an excuse, or how can somebody be disabled from a mental illness? Or, they're just lazy or they're just faking it. Just because you can't see an illness, just because someone isn't in a wheelchair or wearing crutches, doesn't mean that they're not suffering and suffering greatly. So, one of the things that's so debilitating about depression when it's severe, chronic, or untreated is that just the little things like getting out of bed, even, can seem like the most difficult, the most challenging task that you can face. And just being able to get out of that bed, to be able to take a shower, to be able to put on the clothes, sometimes to be able to put on that fake smiling face and make it to work, make it home, just barely functioning through the day. That's depression. That's how depression feels. That's how it looks when it's someone in your family or a friend. Maybe you think, oh, why aren't you doing more around the house? If it's your spouse or a child, you should be doing more around the house. Why aren't you going out and playing with your friends? Um, why don't you want to go out, go to the gym with me? Why don't you want to come to the party? We're all going to the party. Um, this person may very well be depressed, may be very well suffering from anhedonia, which is the lack of joy, the lack of motivation to do things that they once found enjoyable. And that's how that looks. So if someone starts retreating to their bed, not getting up, perhaps looking a little bit less pulled together, how they look physically, how they act, how they interact with you, it's not that they're lazy. It may be that they're depressed. So please be aware of these signs and be aware that they may be hiding their depression from you. So, the last thing I really want to talk about today is treatments for depression. And treatments do exist, they're really good treatments. I want you to go talk to your doctor if you feel like any of these things that I've said, if they ring true to your mind, please, please go talk to your doctor. Don't try to diagnose it yourself. Don't try to treat it yourself. Don't think, oh, I don't need any help. Go talk to your doctor. Go get help. if you don't have the wherewithal to get help, think about calling 988. Think about calling that number. That number is there for you to use, for you to get connected with the help that you need. Another place that you can look is NAMI, National Alliance for Mental Illness, NAMI.org. They have people who can talk to you. They have meetings you can go to. You can get help. Help is out there. The first thing people think about, of course, when they're looking for help is, do I need medication? And so medication is one of the things that only your doctor can decide whether or not you should have medications. And there are safe and effective medications out there. There are a lot of classes that can help you feel better, to help you get over the hump, to help the depression go into remission. Medications like the SSRIs, the selective serotonin reuptake inhibitors, or the SNRIs. We have drugs like Prozac and Zoloft and Effexor and duloxetine. We also have other medications like Wellbutrin, which is an atypical depressant. We have mood stabilizers. There's all sorts of medications. And if you're worried about side effects, talk to your doctor about side effects and get the medication that's going to work best for you, because everyone's going to have different side effects. And you want the medication that's going to be working best for you, because the medication isn't going to work if you don't take it. And the best medication for you is the one that works for you. Also, there's therapy. You can look online for a local therapist. There's a lot of therapists that do even therapy over your internet, over your computer. You can do telehealth therapy if you want to, or in person. And that can be very, very helpful. And lifestyle measures are good too. Light therapy, and that's literally light. Sunlight is really good for your mental health. Going out for a walk in the morning, getting that sunlight on your skin, getting the sunlight that goes into your eyes. You don't want to look at the sun, obviously, but there is something called light box therapy and light therapy that helps kind of reset you. And for some people, especially people with seasonal affective disorder, the light therapy is particularly useful. And of course, there's also the lifestyle exercise, because exercise is one of the most effective treatments for depression. And some studies have shown some equal efficacy to some medications. So regular exercise is really, really important. But first, you have to get yourself out and do it. And you might not be able to go out there and do it until you get yourself over the hump with medication or counseling first. So there are effective treatments out there. Sunlight, exercise, healthy diet, medication, and therapy. You can get started on it by going to your primary care doctor, asking for help. And it's nothing to be embarrassed about. It's nothing to be ashamed of, because help is there, help is available. So depression is very, very common. Almost 1 in 5 people are going to experience depression. So it's very important you know how to recognize it and know where and when to get help. And another topic that I'm going to bring up soon is how to treat what's called refractory depression, because some people have depression that isn't seeming to get better with the usual treatments. But there's hope for you too, because there's some really exciting new treatments out there. And I hope to have a specialist on to talk about those new interesting treatments for refractory depression coming up soon on Speak Life New Haven. So if you see somebody today, be sure to speak some life into their world. And we'll see you next time on Speak Life New Haven.
Tune in next time for Speak Life with Dr. Amy Chai at ctpolitics.tv.